Hi, today we're going to be covering why MAO inhibitors can cause a hypertensive crisis. MAO inhibitors, or monoamine oxidase inhibitors, are given in depression, specifically the type of depression which is treatment resistant. MAO inhibitors are not the first line agent for depression, so you have to consider that this person has a severe depression which is refractory or hasn't responded to other treatments thus far. So how can a MAO inhibitor cause a hypertensive crisis? A MAO inhibitor is a monoamine oxidase inhibitor. What is MAO responsible for in the systemic or portal circulation? What is tyramine, and how can it cause a cheese reaction or a hypertensive crisis? So the cause of a cheese reaction or a hypertensive crisis is twofold. It's the use of a MAO inhibitor, which is, an antidepressant agent, and it's also eating cheese or drinking wine on top of that. The reason is because cheese and wine contains tyramine, which is a specific type of amino acid. And this amino acid is called tyramine, and this amino acid essentially increases the dopamine, norepinephrine, catecholamines. It increases the catecholamines that are already there by displacing them. So think of tyramine as a light switch that turns on all of the sympathetic nervous system indirectly by activating catecholamines. So tyramine is a light switch which turns on the sympathetic nervous system. Therefore, if we have excess tyramine in the human body, it's going to trigger the sympathetic nervous system. So it's going to cause the high blood pressure, tachycardia. It's going to cause a headache and visual blurriness, for example. And these features are because tyramine is not being broken down. So these features are because of the sympathetic stimulation action. Tyramine, the amino acid, is contained in cheeses and wine. Tyramine is a sympathetic stimulant which activates the fight or flight response, raising the blood pressure, dilation of the pupils, and inhibition of peristalsis. Tyramine doesn't turn on the sympathetic nervous system by itself. It's like the hand that turns on the light switch. The light switch are the catecholamines that are turning on the sympathetic nervous system, but tyramine activates those. Now, what's MAO got to do with all of this? So MAO is the thing that breaks down and starts the breakdown of these catecholamines, or starts the catabolism or the breakdown of these catecholamines. That is what MAO exactly is. So if we are giving these depressive patients MAO inhibitors, they will have higher levels of these catecholamines, leading to a more positive outlook. Now, if you're taking MAO inhibitors, and then on top of that, you eat a lot of fermented foods, that's going to cause excess tyramine to go into your GI. And from your GI system, your MAO inhibitors aren't working to break down, your MAO enzyme is not working to break down your tyramine because you're taking an inhibitor, which is going to stimulate the stimulate the tyramines to go into the systemic circulation, leading to all of these symptoms: severe hypertension, 200/100, blurry vision, and headache. Okay? That's it. And you can take vasodilators.